Hi all, I hope everyone is doing good. This is the gold badge which I received from this official OET site. Once we secured B score or above, they will provide this gold badge for us. You can also attain it if you practice well and achieve the B score for your OET. So today I am here with another case note explanation. So as I mentioned before in my other videos, even though I am providing some tips and example answer for these letters, what you have to do, just get the case notes and try to develop your own answer. In that way you can develop your skill. Otherwise, once you are going for the exam, it will be very hard for you to develop the answers. So just try to get some points and try to manipulate and make it in your own way. Okay, so let's see how we can do the case note. So once again I want to mention you, once you receive the case note, you have to look for who is the reader and what's your position, and is there any relationship between the reader and this patient. That means, is it a unknown case or known case? Accordingly, we have to select the relevant information. So let's start. So as you know, the total time for the writing is 45 minutes. 5 minutes for reading and the writing time is 40 minutes. From this 40 minutes also, you can take another 5 minutes for your preparation to make the skeleton. You can just take 5 minutes and try to understand what all information you have to include, the relevant information. You can just put it in which paragraph you have to include this information, like that you can make. So it will be easy for you to write it within 30 minutes. Then you can take the another 5 minutes for your proofreading. So let's look this case note. Today's date 20 July 2019. You are a registered nurse working in a holiday resort, Bayline Road, Auckland, New Zealand. So your position is registered nurse who is working in the holiday resort. Patient details: Mr. Alan Marco, aged 38, accountant at Wellington Island in New Zealand, came for a holiday trip with his family for 2 weeks. Then daily scuba diving, regularly swimming in the resort for the past 2 weeks. So diagnosis: localized right external ear infection and uncontrolled blood sugar level. Present complaints: Alan has severe earache for 5 days. Assessed pain scale 4 out of 10. Blood sugar level is unstable. So these are the information we got it. So let's go on. And what are the subjective? Right ear pain for 5 days. Taken paracetamol which is ineffective. Then self-inserted cotton swabs to clean the ear. Flushed with water inside the ear. Then objective: vitals taken, temperature is 37, pulse rate is, respiratory rate normal, VP, everything is normal. Right ear is hot while touching, tenderness and palpation. Ear canal swelling and redness. External ear redness and without ear discharge. These are the observed symptoms we can see. Then another thing, tympanic membrane pale green color. Then social history: type 1 DM, self-controlled on insulin, cigarette smoking 10 in a day, tried to quit but unsuccessful. Then diagnosis: localized right external ear infection, that is otitis externa, increased water activity, maybe due to increased water activity, and unstable blood sugar level due to infection or increased physical activity, that is query, that is not confirmed diagnosis. Treatment: advised to take over the counter medication due to ineffectiveness of paracetamol. And started ibuprofen for mild pain. Advised to refrain cotton ball insertion and swimming. Then monitor blood sugar level regularly. Increased insulin if high. Recommendations for GP: consultation for formal diagnosis. Review insulin therapy. Pain management for pain relief. Call made to local GP to visit holiday resort to consult Mr. Alan Marco immediately. Then what is the writing task? Using the information in the case note, write a letter to local general practitioner Dr. Cyril John, the HELNA'S Medical Clinic, Auckland, New Zealand. So our reader is the local GP. We are referring him for the urgent consultation because it's made to consult Mr. Alan Marco immediately. So let's see how we can write it. So the reader is Dr. Cyril John, local general practitioner, the HELNA'S Medical Clinic, Auckland. The date is 20 July 2019. Dear Dr. John, reference Mr. Alan Marco, aged 38. In the introduction, I am writing to request immediate consultation and further treatment for Mr. Alan Marco, who has localized right external ear infection and uncontrolled blood sugar level. Then we can give some information about him, the social. Can tell Mr. Marco came for a holiday trip in the resort and was involved in water sports activities for the past 2 weeks. So the doctor got some information. Then how we can write. Today Mr. Marco presented with a severe right earache for the last 5 days and reported cotton swab insertion and water flushing to clean the ear. On examination, he has redness, swelling, tenderness, and pale green color of the tympanic membrane without the ear discharge. Then, consequently, ibuprofen was prescribed for him due to ineffectiveness of paracetamol and advised to avoid cotton ball insertion and swimming. Next, we can move on to the social history. Mr. Marco has type 1 diabetes mellitus for which he is on insulin. On assessment, his blood sugar levels were found to be elevated, most probably due to infection or increased physical activity. Why? Because it's their query. It's not yet confirmed. That's why I use most probably or suspected due to, like that we can write. Then please monitor his blood glucose level regularly and adjust the insulin dose accordingly. Can connect the information even before in the recommendation paragraph. Then what is the recommendation? Considering the above information, it would be appreciated because there is nothing. They told consultation for formal diagnosis. So how we can write? If you could assess, diagnose and treat Mr. Marco's condition as you feel appropriate or as you deemed appropriate. Then the pain management they have mentioned. So we can replace manage his pain as he has severe pain, like there's something we can write. This is only, I think it's easy for you to understand. And if you need more clarification, please comment below in the comment box. Once again, thank you for supporting my channel, and if you find this a beneficial video, please share with your friends, and if you're watching first time, please like and subscribe. Thank you very much. Thank you for supporting.